All right, so now we need to talk about joints. And this will be the last thing that's included on this upcoming exam. So your next exam, skin, skeletal, joints. Make sure everything is working. All right. So joints or articulations, where two or more bones meet. Now, obviously this gives you mobility, but another function of the joints is just to hold you together. Not all joints move, so we classify joints based on their structure and their function. Often we classify joints based on their range of motion. That's how much motion the joint allows. We have the synarthroses, which are immovable joints, the amphiarthroses, which are kind of movable, and then the diarthroses, which are generally what we think of as joints. Those are the freely movable joints of the body. Now, structurally, we can also classify the joints, and we can base this on what sort of structural material holds the joints together and whether or not we have something called a joint cavity. Structurally, there's three classifications: fibrous, cartilaginous, and synovial. A fibrous joint, bones are joined together by dense fibrous connective tissue. There's not a cavity there. The vast majority of these are synarthroses. A synarthrotic joint is an immovable joint. And these include the sutures, which hold the bones of the skull together, which we've seen before. The reason there's a joint there at all, and that it's not like a solid piece, is your head grows, right? So the bones grow out there on the edge until middle age, when they're synostoses, those sutures seal. We looked at the real skull in the lab video. It's one piece. Now, those bones aren't super tightly fused, but they are fused together. Before then, you'll see fibrous connective tissue there. So there is the suture, really little dense fibers holding the bones together. A syndesmosis is when bones are connected by ligaments. Now, a ligament is fibrous connective tissue that holds one bone to another. Not to be confused with a tendon, which holds a muscle to a bone. A syndesmosis can be movable slightly or completely immovable. So here is the distal tibiofibular joint. That's a synarthrosis. That doesn't move. Megamphosis is what holds your teeth in socket. The little ligament that holds your teeth in socket is called the periodontal ligament. There, periodontal ligament. So when your kids lose their teeth, that periodontal ligament dissolves, and then all that's left that's holding it in is that blood vessel, and then if it's super gross, I hate teeth. Let's move on. All right, cartilaginous joints. When bones are held together by cartilage. Again, there's not a joint cavity here. There are two types of cartilaginous joints. A synchondrosis, when hyaline cartilage holds the bones together, these don't move. There's a synchondrosis, the epiphyseal plate. And then there's the synchondrosis, the joint between the first rib and the sternum. And then there's a symphysis. A symphysis is slightly movable. It's when you've got fibrocartilage in between the bones. It's a shock absorber. There's the symphysis, that's the intervertebral disc. And then here's the pubic symphysis. And so that's fibrocartilage holding the bones together. So all of that to say that really what we care about and what we think about when we talk about joints are the synovial joints. Now the synovial joints are all diarthrotic joints, freely movable joints. This is most of the joints of your body. Every synovial joint has some distinguishing features. First of all, the bones are lined by articular cartilage, that hyaline cartilage that reduces friction in the joint. And the bones aren't directly touching each other. There's a joint cavity, there's space in between the bones. Remember that bones grow in response to the stress you place upon them. So you've got one bone and another bone expertly drawn. If those bones are moving and they rub against each other, that gives you friction. Friction's a force, and bones grow in response to that force. This articular cartilage reduces the friction between the bones, but if you ever get any friction there, the bone's going to grow in response to that friction. You're going to get bone spurs. Surrounding that potential space is the joint cavity, or the joint capsule, or the articular capsule. This is dense irregular connective tissue on the outside and loose connective tissue on the inside. And inside that, you've got fluid, synovial fluid. Cartilage devascular. This is going to help carry nutrients to cartilage, and it's going to help lubricate the joint. So you see the synovial fluid in here. Well, this is encapsulated here by this joint capsule. Put enough pressure on this, and you can herniate that joint capsule. You can push the fluid out here so it kind of bubbles out. So imagine squeezing like one of those, a balloon filled with jello or something, and you squeeze it out. This is something that occurs. There's 8 tiny little bones at the wrist that slide past each other, but still it's a freely movable joint. So it's a synovial joint. We get this joint capsule thing, there's fluid there. And it's not uncommon to see someone who herniates that joint capsule and forces fluid out into the capsule. It's something called a Gideon cyst. It's called a Gideon cyst because rumor has it that, and I don't know, I'm not this old, but apparently the treatment for this used to be, you have this person, and if you Google pictures of this, you'll see it, and there's like this little swelling bubble looking place on the back of the wrist under the skin. It's like there's another wrist bone there. It can get pretty hard. So there's this herniation of that joint capsule. Treatment used to be take the biggest book you could find, which more often than not was the Bible. Think Hotel Bible, which are placed by the Gideons, and then smash it. And you'd make that little herniation explode, and the fluid would disperse or be reabsorbed. Problem solved. Ish. I mean, it's probably going to come back, but for right now, it's fine. When we have movement, we lose stability. The more movable a joint is, the less stable it is. The most stable configuration is to fuse those bones together, but that doesn't move. We want movement, we have to sacrifice stability. So we have things to reinforce the joint. There are 3 possible types of ligaments to reinforce the joint. The capsular ligament. This is part of the joint capsule. So like here, capsular ligament. Right? But some joints have extracapsular ligaments, ligaments above and beyond the joint capsule, or even intracapsular ligaments, which are back behind it, under the joint capsule. Joints have lots of blood vessels to make that synovial fluid. And there's also nerves there. Nerve fibers detect pain, and they inform your brain of your position in 3-dimensional space so that you know where your hand is. You don't have to look at your hand, you know where it is without even looking at it. There are lots of structures there to reduce friction because friction is bad for the bones. Anytime you apply friction, you're going to get growth and bone spurs, that sort of thing. There are bursa. Bursa are these sacs of fluid that act like ball bearings between the bone and something, the bone and skin, the bone and ligament, the bone and muscle, whatever, to keep friction off the bone. And if you're unfamiliar with the concept of ball bearings, right, if you have really decent drawer guides in your kitchen drawers, they're on ball bearings, so that when the drawer moves, it slides across those little steel balls, which rotate with it. Each one of the balls rolls, and there's no friction, right? Because it's rolling with it. Imagine trying to walk on marbles, right? You can't pick up any traction because they're turning underneath you. Ball bearings. And so these roll underneath whatever structure. Here's what's called a subacromial bursa, so that when the shoulder rotates, that ball bearing of fluid rotates as well and rolls between there and prevents the head of the humerus from rubbing on that tendon. A tendon sheath is the same principle, which is really long and wrapped around the tendon like so. Here's the tendon sheath around the long head of the biceps tendon. Now, stability, like I said, is important. The bones, they're not helping you out. If the bones provided any stability, I wouldn't have to screw a skeleton together to make it stand on that stand and just pop into place like Legos. The ligaments help limit the movement of the joint so that it doesn't move past its range of motion. It might help support the weight of the joint, but it's a really limited role. The major factor holding your joints in place is muscle tone. Muscle tone is the constant tension on muscles. Your muscles are never completely relaxed. There's always some tension there. That's muscle tone. And it's muscle tone, that tension on the muscles, that holds the joint in place. The muscles that cross your shoulder, for instance, hold that shoulder socket, that the bones of the shoulder in place up against your body. So muscle tone, the most important stabilizing factor in a movable joint. Lots of muscles crossing these joints. Now, when we talk about muscles crossing the joint, we often talk about the origin of the muscle. The origin of the muscle is where it attaches to the structure that's not moving. The insertion is where it's attaching to the structure that is moving. Insertion moves toward the origin when the muscle contracts. Muscles work by getting shorter. We can classify synovial joints by their range of motion. Non-axial, uniaxial, biaxial, multiaxial joints. All joints have their names. I don't expect you to remember this. That's why there's a chart. So let's look at some of these movements. In a gliding movement, one bone slides past another. So the joints in between the wrist bones, right? Those bones just kind of shift past each other. There's not any real movement there, just a little bit of gliding. Angular movements, like flexion and extension. Flexion decreases the angle of the joint, extension increases it. Hyperextension goes past that stopping point. So here's flexion, extension, hyperextension of the neck. Same thing with the vertebral column. Flexion, extension of the shoulder and the knee. No, they don't have hyperextension in this picture because they didn't pay her enough for that. That $50 they paid her to do all this crap wasn't nearly enough to hyperextend her knee. Movements in the frontal plane, we have abduction and adduction. Abduction is to move it away, adduction to move it back toward you. Circumduction to move it in a big circle. There's abduction, adduction, and then circumduction of the shoulder. Rotation, turning the bone around its long axis, so there's rotation of the head, the hip. The movement of the radius of the ulna get their own terms. Pronation and supination. This is one way to do this. The easier way to do this, pronation, palms face backward. Supination, palms forward. So there's supination, pronation. The foot has its own movements, dorsiflexion, plantar flexion. There's dorsiflexion, plantar flexion. The foot also does inversion and eversion. Inversion, eversion. The jaw is capable of protraction and retraction, moving back and forth, and depression and elevation, moving up and down. The thumb is very special because it is opposable. Ever heard that term, opposable thumb? What it means when you have an opposable thumb is that you can touch your fingers with your thumb. So there's the opposable thumb. Synovial joints can also be classified on the shape of the surfaces. Plane joints are non-axial joints where we get gliding motion. There's a plane joint. Hinge joints are just what they sound like the elbow. Hinge joint, flexion and extension only, uniaxial joint. Pivot joints, you have the rotation of a bone. So there's the pivot joint, the radius and the ulna. Condylar joints are biaxial joints, meaning you get more than one angular movement. Condyle means knuckle. So there we are here at the metacarpal phalangeal joint. There's a lot more range of motion there. Saddle joints are a special case of the biaxial joint, and this is why we have an opposable thumb. And that saddle joint allows that to happen. Ball and socket joints are the most freely movable joints. They're multi-axial joints. There's a ball and socket joint. So let's talk about some special joints. The knee. The knee is the most complicated joint in the body. It's a super big joint. It's actually 3 joints. There's a joint between the femur and the patella, joint between the lateral femur and the lateral tibia, the medial tibia, the medial femur. So we have these tibiofemoral joints. It's easier to say. So femur on the medial side, femur on the lateral side, and then the femur and the patella. Big joint, flexion, extension, some rotation. There's the femur, there's the tibia, here's the kneecap. There's a lot of structure here. Here's looking down at the tibia. You've got your cartilage here, these menisci. Here's your cruciate ligaments. There are at least 12 bursa here. And most of the stability is from that patellar ligament or the reinforcing ligaments. And you see this flattened tendon bed that's called a retinaculum. There's the quadriceps tendon, patellar ligament, fibular collateral, tibial collateral ligaments. They help to prevent hyperextension. There are ligaments underneath this that prevent this femur from slipping off the top of the tibia. And we see those cruciate ligaments there. Collateral ligaments out here. Knee injuries are very, very common, especially when you look at sports. The knee can take a lot of stress, but when you flex it and it gets hit, any sort of torsion can do some serious damage to the knee. And knee injuries heal really slowly because those structures aren't very vascular. Here's one of my favorite pictures in any textbook. This is called the unhappy triad of knee injuries. So in the unhappy triad, you get the anterior cruciate ligament here, the tibiocollateral ligament here, and the medial meniscus there. So 3 things. This particular textbook used this illustration where a hockey puck is hitting you in the knee. I've watched hockey. That's never been a thought I've had. I'm like, oh no, that puck hit that guy in the knee really hard. I just don't think it's a thing. Replace that, for our purposes, replace that with like some guy's head, football helmet, football pads, and well, then you get it. With a knees inflection, it looks like that. Right, knees inflection, dude hits it, tears those three things. Here's dislocation of the knee, dislocation of the kneecap. Again, that tear there. Here is a full-blown dislocation. That one's ugly. Not that this one's super awesome. I mean, for him. The shoulder, very, very movable joint, so we lose some stability. It's a ball and socket joint. Ball and socket. Not nearly as much structure, so look at this compared to the knee, there's a lot less structure here, and you get a lot more movement. Ligaments here between the coracoid process and the humerus, the glenoid fossa and the humerus. The muscles here from the biceps and the rotator cuff tendons that make a circle around the shoulder joint. There you go. Here we are looking down at the socket. This is the most commonly dislocated joint in an adult, but it is very easy to dislocate, especially in children. Why? Because you're taller than they are. Why does that matter? Well, you're holding the kid's hand and you pull straight up on that. Like if he's standing in front of you and his arms are straight up in the air, and you pull straight up on those arms, that's it. You jerk the arm strongly upward, dislocate the shoulder. Or if their hand is sticking out, if your arm's sticking out, and you get hit from above, it will pop that out. And that's what you see. Well, here you have him reaching out with his arm, catching it, and it's going to push it up and out. Hers, she had the arm adducted or sticking out, and then something came down from above and hit it and popped it down and out. Now, this is not, and this is sort of a public service announcement from my point, this is not like Lethal Weapon or whatever. You do not just pop that crap back into place. You're going to want some medical attention. Someone who knows what they're doing so they can rotate it and ease it back into place and not just slam it back in like you're freaking Mel Gibson. You're not. That's not how that works. There's a high risk of you damaging more tissue. You pinch a nerve, blood vessel, and do some permanent damage to the arm that way. Right? Break a bone. It's not uncommon to see fractures with dislocation. So here you see dislocated shoulders. The elbow, not nearly as much movement as the shoulder. So hinge joint, flexion and extension only. So there's some of the structures of the elbow. Annular ligaments, some capsular ligaments. There you go. Not nearly as much structure. The elbow is the most commonly dislocated joint in children, but here you see it in an adult. If the Olympics ever come back, Summer Olympics, you watch this, you watch weightlifting, you'll see somebody dislocate their shoulder. They'll be lifting like however 14 million pounds or whatever the crap that is. A stupid amount. And when they're lifting the weight's so heavy, it pushes the elbow down and out. And they'll show it like 40 times in slow motion, so you'll get lots of chances to see this. It is the most commonly dislocated joint in children. Why? Because they just won't come with you. Right? You're walking along and the kid stops moving. You're holding his hand. What do? Yank his arm. Come with me. And pop. The elbow's out of socket. And again, you're not just going to pop that stuff back into place, especially this one, because you don't want to do damage to the bone. You don't want to cause fractures because of that. The hip joint, another ball and socket joint, it's freely movable. It's not as movable as the shoulder because this acetabular labrum enhances the depth of the socket. You see that right there? Reinforcing ligaments here between the ilium and the femur, the pubis and the femur, the ischium and the femur, ligamentum teres. Those are great. They help reinforce the joint. The biggest muscles in your body cross the hip joint, the gluteus muscles, the adductor muscles here in the front, the gluteus muscles, the quadriceps. There's lots of muscles crossing through here. It's difficult to dislocate a hip. But when it happens, it's supposed to be one of the most painful things you can ever encounter. I don't have any like sports injuries here. This is blunt force trauma, like this is car wreck sort of thing. Hip dislocation happens most frequently in infants and the elderly, and you see the full dislocation there. There's a big nerve there, there's big blood vessels, this is a high risk injury. Again, not something you just want to pop back into place because you saw how to do it on YouTube. The last joint we'll talk about here is the temporomandibular joint, the jaw, and the temporal bone and the mandible. And here you get a hinge joint, depression elevation, and the gliding joint. This is the most easily dislocated joint in your body, but not very commonly dislocated. There's just not a lot of support here, either with muscles or the bone structure. Right? You've got facial muscles crossing. There's not a lot of facial muscles, and they're not particularly strong. And the jaw does this crap, this side-to-side movement, which makes it really prone to dislocate. How do you dislocate your jaw? You punch in the face. Get hit in the face, you might get your jaw dislocated. Like this dude, he's gonna be eaten through a straw. This dude's not any better. More common than dislocation is something called TMJ syndrome. That causes this sort of clicking and inflammation of the joint, and it spreads to the nerve and makes you dizzy and can cause intense pain. There are lots of terms that we use here with the joints. A sprain is damage to the ligament. Complete rupture of the ligament is going to require surgery. Cartilage tears are going to require surgery because cartilage doesn't really repair itself. It's avascular. Here's a torn medial meniscus in the cartilage. Dislocation, often called the luxation, is when the bone is forced out of the joint. And obviously with that, you're going to damage the associated connective tissue. Subluxation is partial dislocation. It's not all the way out. Any freely movable joint will dislocate. Ankle, that looks like it sucks. Either he put that shoe on wrong and just realized it, or he has a backwards foot now. Here's the finger. Okay, to be fair, this is a soccer match. Why the hell was he using his hands? He kind of earned that one. Dislocated patella. Bursitis is inflammation of the bursa. Anytime you see that itis suffix, that means inflammation. So tendonitis is inflammation of a tendon sheath. Treatment for either of those, stop doing that, anti-inflammatories. There are better than 100 different types of inflammatory diseases that we call arthritis. The word arthritis means inflammation of a joint. As a whole, arthritis is the most widespread crippling disease in the United States. Symptoms are the symptoms of joint inflammation, difficulty moving, swelling. There are many, many different forms of arthritis. Some of them are acute and caused by things that can be treated by bacterial infection. Some of them are chronic. We just have to manage the symptoms. Easily the most common form of arthritis is osteoarthritis. This is just wear and tear. We're probably all going to end up with osteoarthritis if we live that long. The tiny little insults over time add up. This is probably just normal aging. You wear away the cartilage, you damage the joint capsule. It adds up over time, and the joints don't respond as well. I'm here to tell you, when you hit 40, it's like the warranty wore out on your joints. I did that this year. It sucks. But all the little stuff wears up, so you have difficulty moving. You can feel the inflammation there. In osteoarthritis, the cartilage is it's not being replaced, and then you're encountering more friction, and that's going to cause the ends of the bone to thicken and enlarge. Bone spurs, because bone grows in response to the stress you place on it. Wolff's Law. Treatment, stop doing that. And medication. This is an irreversible thing. It's not going to get any better. You can just prevent it from getting worse. Rheumatoid arthritis is an autoimmune disease. We don't know why the hell this happened. Your immune system decides that it hates your joints. Typically, you see it in patients between 40 and 50, and women more often than men. Joint pain. The difference between this and osteoarthritis is that it will be bilateral joint pain. It's not just one of your knees, it's both of them. And various other issues. It begins with synovitis of the affected joint, inflammation of the synovial membrane. Now, rheumatoid arthritis is one that I know a bit about because my 10-year-old has rheumatoid arthritis. He's had it since he was five or six. When he was in kindergarten, his brothers had to carry him into school because he couldn't walk. By the end of the day, he could walk again, but it looked like he had cerebral palsy. Just barely walk. It took us a while to find a rheumatologist. We have to go to Cook's Children's in Dallas to see a rheumatologist. We don't know why, but the joints became inflamed. His knees were gigantic. He's a skinny little kid, and the knees just swelled up. For whatever reason, his immune system sent cells to the joint, inflammatory chemicals are released, and that membrane starts to thicken. Synovial fluid gets thicker, the membrane gets thicker, it's harder to move. And when you do move, that pannus, the inflamed synovial membrane, begins to wear away the articular cartilage. You do that fast enough, the cartilage gets replaced with scar tissue, and eventually the bones will ankylose. Here's an x-ray of rheumatoid arthritis. We see bone spurs there, but there should be eight tiny little bones there. There's not. There's just like one giant bone, right? Because it's fused together. Inflammation here has completely dislocated that pinky finger. We have fusion here. What's that look like? So, treatment for rheumatoid arthritis used to be like anti-inflammatories like aspirin, antibiotics to try to keep you from getting sick. If you have any autoimmune disease, you know that when you get sick, it's worse. So you prophylactically treat getting sick. Then we came up with we used anti-inflammatories like steroids and things to suppress your immune system, methotrexate. But today, we have a wide variety of drugs that are called biological response modifiers, or biologics. And they neutralize the inflammatory chemicals released by the immune system, and they prevent the inflammation and thereby the damage. Ask your doctor about prescription Enbrel or Humira or whatever. Henry does Enbrel. And it's for him right now, it's 2 injections a week. He's a brave little kid, started with 1 injection a week. Hates shots, hates needles. But sits through that because he knows the difference. He remembers when he couldn't walk or when walking was just really painful. And as soon as we started giving him those shots, within a week, he was better. Night and day difference. And he's just a normal little kid now. Is he cured? No, we're just treating the symptoms as best we can. Here's gout. Uric acid crystals deposited in the joints, you get inflammation. Treatment for this, stop drinking so much alcohol, drink more water, there's some medications. Lyme disease causes arthritis, but oddly enough, that's the minimum, that's the least of your issues with Lyme disease, that foggy thinking make you crazy. Arthritis is really not high on your radar for Lyme disease. And notice that we're not even on the stupid map. We have zero risk of Lyme disease here. We just don't have those ticks. The joints, like the skeleton, are pretty recognizable by 8 weeks in. Now, how the joint looks as an adult depends on what you do. Its size, shape, how flexible joints are is modified by the use of it. While wear and tear does take its toll on the joints, not doing anything is just as bad. Lots of people have questions about joints. The first one is, what does it mean when you're double jointed? You're not. You're not special. Nobody cares. When I'm dissecting a cadaver, I'm like, oh, this dude's got an extra joint. That's not a thing. The correct term for this is hypermobility. What that means is that your joint is capable of moving past its normal range of motion. Now, you can train yourself like yoga and gymnastics. Those people have hypermobile joints. They're not double jointed. The joints just move more because they're more flexible. If you didn't do anything to earn that, it could be an anatomical difference where the connective tissue is just really stretchy. It could be a sign of something more serious like Marfan syndrome or Ehlers-Danlos syndrome. Here's Ehlers-Danlos syndrome. The collagen isn't correctly formed, so the skin is super stretchy, and the joints are hypermobile. Stupid stuff like this. Fun at parties also affects the heart valves and can be fatal. Marfan syndrome is a similar issue. Super long collagen fibers, hypermobility, potential cardiac failure. So, you're not double jointed, nobody cares. You might want to get that looked at. The next question people always have is, what does it mean when you pop your knuckles? Nothing. You're not getting arthritis, your knuckles aren't getting bigger. Remember that what you have in the joint capsule is potential space, right? You've got space here and it's sealed, it's encapsulated in. There's fluid through here. Now, when you stretch that out a little bit, it goes either way, you increase the volume of that cavity. You increase the volume, you decrease the pressure. When you decrease the pressure, gases that are dissolved in that fluid will bubble out and pop, making a noise. So that's what popping the knuckles does. It's just making that little bubble pop. It's just a noise. It's not going to hurt you. But if it bothers you, you can still lie to your kids. It's cool. All right, so that's the end of this for joints. That covers the material for the lecture exam. The only other thing that I owe you right now for this next upcoming exam are the bones in the skeletal lab, and I'll try to get that up tomorrow.